You know how we all have those little things we do every morning? Like, I always have to have my coffee before I can even think about doing anything else.
Oh, yeah, definitely. I'm a tea person myself,
Yeah,
but yeah, everyone has those little rituals to start the day right.
exactly. And for a lot of us, that includes brushing our teeth, right?
Yeah.
It just seems like such a basic part of taking care of yourself.
It does.
But what's crazy is that millions of kids around the world don't actually brush their teeth very often, or like even at all.
Yeah, it is kind of surprising. You'd think something as simple and essential as brushing your teeth would be something everyone does, but it's not.
Right. I mean, I was reading this study. It was published in Dental and Medical Problems. That's a journal from Wroclaw Medical University.
Oh, okay.
And it's called Toothbrushing Frequency Among Children and Adolescents in 72 Countries. The author is Rajat Dasgupta.
Hmm.
And basically, they looked at data from the Global School-Based Student Health Survey. That's also known as the GSHS.
Okay.
And they had a massive sample size, over 266,000 students.
Wow. So they're really getting a good picture of what's going on worldwide then.
Yeah, exactly. It's
Yeah.
like a global snapshot of how often kids are brushing their teeth.
So what did they find?
Well, here's the thing. 90% of the students said they brush at least once a day,
Okay, that's not too bad.
but only 71% were brushing twice a day, which is what dentists usually recommend.
Ah, I see. So there's a pretty significant gap there. Makes you wonder why, right?
Totally. And I think it really shows how things like access to dental care and just different cultural ideas about oral hygiene probably have a bigger impact than we realize.
It makes sense when you think about it. Different parts of the world have different traditions and priorities.
For sure. And the study actually breaks things down by region too, which is where things get extra interesting.
Oh, really? How so?
Well, the Americas had the highest rate of twice daily brushing, like almost 83%.
Wow. 83%. That's pretty impressive.
Right. And it makes you wonder, is there something about the way oral hygiene is taught or emphasized in that region?
Interesting point. It'd be fascinating to dig deeper into that and see what's going on, right?
Totally. Like, are there specific public health programs that are super effective, or is it more about cultural attitudes toward dental care?
Yeah, it's hard to say for sure based on this study alone, but it definitely raises some really interesting questions for future research, wouldn't you say?
Absolutely. And on the other end of the spectrum, the Middle East and North Africa had the lowest rate of twice daily brushing at only 41.4%.
Hmm, that's a pretty big difference.
It is, right. And it makes you wonder what factors might be contributing to that.
Yeah, it's important to be careful about jumping to conclusions, though. There could be a lot of reasons for that difference.
Exactly. And that's where the study's mention of traditional cleaning methods like miswak comes in.
Oh, that's right. Miswak. I've heard of that.
For anyone who might not be familiar, miswak is basically a natural tooth cleaning stick. People have been using it for centuries, especially in the Middle East.
Yeah, it's like a little twig, right?
Yeah, exactly. And the study authors suggest that because it's not a toothbrush in the way we typically think of it, people who use miswak might not report it as brushing when they're answering these surveys.
That's a good point. It highlights the fact that brushing might mean different things in different parts of the world.
Yeah. And if the surveys aren't taking those different definitions into account, then the results could be misleading, right?
Absolutely. Like, they could be underestimating the actual amount of oral hygiene practices happening in certain regions.
It just shows how important it is to be sensitive to different cultural practices when you're doing this kind of global health research. You can't assume everyone defines brushing in the same way.
No, definitely not. It's a good reminder that we need to look beyond just toothbrushes and toothpaste when we're talking about oral hygiene.
Exactly. And speaking of different cultural contexts, the study also found some really interesting variations between specific countries.
Oh, like what?
Well, in Belize and Paraguay, they found that a whopping 90% of the students said they brush twice a day.
Wow, that's even higher than the America's average, right?
It is. But then on the flip side, in places like Egypt, Yemen, and Morocco, over 10% of the kids rarely or never brush their teeth.
That's pretty concerning. Makes you wonder why such a big difference, right?
Yeah, it's pretty striking. And I think it shows how important it is to consider local customs and beliefs when you're trying to design programs to improve oral health.
I agree. You can't just assume a one-size-fits-all approach is going to work everywhere.
Definitely. It's like a reminder that we need to tailor our approaches to fit the specific needs and cultural contexts of each place.
Yeah, that makes sense. You know, thinking about those regional differences, it makes you realize how much cultural factors can play a role, even in something as seemingly basic as toothbrushing.
Totally. It's like even something as simple as brushing your teeth can reflect deeper societal norms and expectations.
Right, like what are the messages kids are getting at home? What are they seeing their parents do?
It's fascinating. But before we get too deep into that, I have to ask about another finding that jumped out at me. The link between brushing habits and economic status.
Oh, that's an interesting one. What did they find?
Well, as you might expect, wealthier countries tended to have better brushing habits overall,
Makes sense. More access to resources, dentists, all that stuff.
right? But here's the surprising part. The group with the very highest incomes actually had a slight dip in brushing frequency compared to the group just below them.
Oh, really? That is unexpected.
I know, right?
Yeah.
It's not just a simple more money, better teeth situation. There's something else going on there.
It makes you wonder if maybe once people reach a certain level of wealth, other factors start influencing their choices. Like maybe they're more focused on other aspects of their health and well-being.
Yeah, maybe. Or maybe it's that they have access to different kinds of oral hygiene practices that aren't captured in these surveys.
Ooh, that's a good point. Like maybe they're using those fancy electric toothbrushes or getting more regular professional cleanings, things
Right.
like that.
Right. And those wouldn't necessarily be reflected in the data if people are just being asked how often they brush.
Exactly. It challenges our assumptions about what good oral hygiene looks like, doesn't it?
It totally does. It's not just about having the fanciest products or spending the most money. It's more about having a well-rounded approach to dental care that fits your life.
It's like a reminder that there are many paths to good oral hygiene.
Absolutely.
Yeah.
And I think it underscores the importance of education and awareness.
Mm-hmm.
It's not enough to just tell people to brush their teeth. We need to understand the underlying reasons why some people do and some people don't, and then tailor our interventions to address those specific factors.
I agree. A personalized approach, right? Recognizing that different people have different needs and different resources.
Right. It's about finding what works for each individual in each community.
That's a great way to put it. Tailoring our approach to fit the unique circumstances of each situation. So we've been talking about all these differences in toothbrushing habits around the world, but it makes you wonder, why should anyone care?
Right. Like, what does it really matter if some people brush once a day instead of twice? Is it really that big a deal?
Well, it turns out it might be a bigger deal than a lot of people realize. Oral health is actually way more connected to our overall health than we tend to think.
Really?
Yeah, it's not just about cavities and bad breath. Poor oral hygiene can actually increase your risk of some pretty serious health conditions like heart disease and diabetes.
No way. Seriously.
Huh?
I had no idea it was connected to stuff like that.
Yeah, the link is pretty strong. So we're not just talking about a cosmetic issue here. It's about preventing potentially major health problems down the road.
Wow. That puts things in a whole new perspective.
Right. And for kids and teenagers especially, the impact can be huge.
Yeah.
If they have dental problems that aren't treated, it can lead to pain, trouble concentrating, even missing school.
Oh, wow. I hadn't even thought about that.
And all of that can have a ripple effect on their education and, all their future opportunities.
So it's not just a personal health issue either, it's a societal one too.
Exactly. It affects everyone. And that's one of the big reasons why understanding these global differences in toothbrushing is so important, because it helps us figure out where we need to focus our efforts in terms of, education, access to care, and making sure our interventions are culturally appropriate.
Yeah, that makes sense. And you mentioned education earlier. The authors of the study really emphasize how important school-based oral health programs are. But they also said those programs need to be more than just boring lectures.
Exactly. I mean, who wants to sit through a lecture about toothbrushing? We need to be way more creative than that. We got to find ways to make learning about oral hygiene engaging and fun, especially for kids.
I agree. I think we were talking about that earlier. Things like mobile apps and interactive games, that kind of stuff seems like it would really grab their attention.
Totally. Think about it. We've got apps for practically everything these days. Why not for toothbrushing?
Makes sense.
And, it also makes me think back to what we were discussing about miswak. If we want these programs to be effective worldwide, we need to make sure they're relevant to the local culture. Like in areas where miswak is widely used, maybe it makes more sense to incorporate that into the curriculum rather than trying to replace it with toothbrushes altogether.
Yeah, that's a really good point. I mean, respecting local traditions while still encouraging healthy habits seems like the best way to go.
Absolutely. We need to find that balance between what we know from science and being sensitive to different cultural practices.
Right, because what works in one place might not work somewhere else.
Exactly. But, it's not just about the kids either, right? Parents play a huge role in shaping their kids' oral hygiene
For
habits.
sure. I know my parents were always on me about brushing my teeth when I was a kid.
Yeah, parental involvement is so crucial. They need to model good behavior themselves, encourage regular brushing, and make sure their kids have what they need to take care of their teeth. But it's also about understanding the cultural context, right?
Oh, yeah. Like you were saying before, what's considered normal or important in one culture might be totally different in another.
Exactly. Like in some communities, dental care might not be seen as a priority, or people might have misconceptions about how important it is to start taking care of your teeth early on. So those education and awareness campaigns need to target parents too.
Makes sense. So it sounds like we really need a multi-pronged approach to tackle this issue. We need to address cultural beliefs, improve access to care, and make education engaging and relevant for people of all ages.
You got it. It's a complex issue for sure. No easy solutions.
Yeah, it's a lot to think about. So where do we even begin with something this big?
Well, I think a good place to start is just by being mindful of our own habits. Each of us can make sure we're setting a good example for the kids in our lives.
That's a great point, like leading by example.
Exactly. And we can also support those school-based oral health programs, right? Whether it's through volunteering, donating, or just speaking up about how important they are.
Yeah, that's a good one. And what about advocating for policies that make dental care more accessible, especially for communities that are struggling to get the care they need?
Yes, absolutely. A lot of people don't realize just how hard it is for some communities to access even basic dental care. So pushing for those policy changes is crucial.
And I think it's important to remember those cultural nuances we were talking about.
Mhm.
We have to be respectful of different cultural practices and understand that what works in one part of the world might not be appropriate or effective in another.
Yeah, that's so important. We need to approach this issue with an open mind and a willingness to learn from people who have different perspectives than our own.
I love that. Be open, be proactive, and stay informed. It sounds like a lot, but it's all really important.
It is, but remember, even small changes can make a big difference. Like if we can improve oral hygiene habits in one community, it can have a ripple effect and inspire others to do the same.
That's encouraging.
Yeah, it's all about changing mindsets, shifting those cultural norms, and empowering individuals to take control of their own health. And who knows, maybe one day brushing twice a day really will be something everyone does, no matter where they live.
Oh, that's a great goal to work towards. Okay, so we've talked a lot about the problem, all these differences in toothbrushing habits around the world, but what can we actually do about it? Like, how do we actually improve oral health on a global scale?
That's the million-dollar question, isn't it? Well, remember how the study authors talked about those school-based educational programs? I think that's a great starting point.
Yeah, those seem really important. But we also talked about how they can't just be boring lectures, right? We need to make learning about oral hygiene fun, especially for kids.
Oh, for sure. Nobody wants to just sit and listen to someone drone on about brushing their teeth. We got to be more creative than that.
Exactly. Like we were talking about before, those mobile apps and interactive games could be awesome.
Totally. I mean, think about it. Kids are glued to their phones these days, so why not use that to teach them about taking care of their teeth?
Yeah, that just makes sense. But I'm also wondering about those traditional methods we talked about, like miswak. Is there a way to integrate those with more modern approaches to oral hygiene?
I think that's a really key point. We shouldn't just dismiss traditional methods as being wrong or outdated.
Yeah,
We need to understand why people use them and what benefits they might have. And, like we mentioned before, miswak actually does have some antibacterial properties.
oh, right. It's not just a cultural thing. There's actually a scientific basis for it.
Exactly. So maybe instead of just trying to get everyone to switch to toothbrushes, we can look for ways to combine those different approaches.
That makes a lot of sense.
Mm.
Like blend the old and the new. Respect cultural traditions, but also promote practices that have scientific backing.
Right. I think that's a much more nuanced approach. And it's not just about educating the kids themselves. We need to get parents and communities on board too.
Definitely. After all, habits are formed at home. Parents play a big part in teaching their kids how to take care of themselves.
Exactly. So we need to make sure parents understand why oral health is important and how they can support their kids in developing good habits.
That makes sense. But what about places where access to dental care is a problem? Like there are parts of the world where people just don't have easy access to dentists or affordable treatment.
You're absolutely right. That's a huge barrier for a lot of people. So we need to advocate for policies that make dental care more affordable and accessible, especially for low-income communities and people in rural areas.
Okay, so it sounds like there's no easy fix. It's going to take a lot of different efforts working together.
Yeah, there's no magic bullet, unfortunately. It's going to require collaboration between governments, healthcare providers, educators, community leaders, everybody, really.
It's a big challenge.
It is, but, I think even small changes can make a difference. Like, if we can improve oral hygiene habits in one community, it might inspire other communities to do the same. And over time, all those little changes can add up to real progress.
It's a good point. Every little bit helps.
It does. It's about changing mindsets,
Yeah.
shifting those cultural norms and giving people the knowledge and resources they need to take charge of their own health. And who knows, maybe someday brushing twice a day really will be a global habit.
That would be amazing. Well, this has been such an eye-opening deep dive. I feel like I've learned so much about toothbrushing